MAiD stands for Medical Assistance in Dying, and as a result of a lot of education and advocacy, MAiD has been legal in Canada since 2016 for people who meet the eligibility criteria. So MAiD permits a doctor or a nurse practitioner in Ontario to prescribe and or administer medication for an eligible patient that causes death. The procedures for most MAiD deaths in Canada is through a series of IV medications, in contrast in the US, where they use only oral medications. Federal legislation sets out the eligibility requirements for MAiD and the procedural safeguards for protecting patients and the process by which MAiD can be provided. It's quite heavily regulated. I think it's like all end of life discussions, people are hesitant to discuss, and many people don't know what medical assistance in dying is. So I think it just is that general, as a society, we need to be having more conversations around end of life issues, which MAiD is a part of. Well, MAiD is legal. Not everyone is aware about medical assistance in dying, and also it isn't always accessible. So House was established in 2018 to meet this gap. Some people do not want MAiD in the hospital or home for a variety of reasons. So MAiD House provides a free home-like setting for the procedure in the community. In addition, we're developing grief and bereavement supports and resources related to MAiD, and we engage in research, education, and training. Absolutely. So MAiD can happen in your home, in hospitals, in any community-based environment outside. So it really depends on your end of life wishes and where you would like that to happen, and and where your MAiD provider is willing to have that happen. So Health Canada actually puts out a yearly report, and they've released two to date. So in 2019, there were 5,425 medically assisted deaths in Canada. So that accounts for about 1.9% of all deaths. In 2020, this increased to 7,383 deaths. That's about 2.4% of all deaths in Canada. And it represents a 36% increase in the number of MAiD recipients from 2019 to 2020. And MAiD House anticipates that that will continue to increase. Interestingly, in Ontario, as of November 30th, 2021, there were 2,804 cases of MAiD. Some other interesting information is actually the average age of a MAiD recipient is between 74 and 75, and the underlying condition leading to more than 2/3 of MAiD cases is cancer. I think it's important to note that 87% of Canadians actually support MAiD. And as we discussed at the beginning, like all end of life issues, it's important for families to communicate. As there is a predetermined date for MAiD, there is an opportunity for conversations and to do pre-planning. And a good resource for people to be aware of is like Dying with Dignity Canada, Bridge for You, Bridge C14, and the virtual hospice. They have great information about MAiD and how to facilitate some of the conversations that would be helpful as you start planning for a MAiD procedure. If for funeral professionals, if a family comes to a funeral home with a set date, it is most likely going to be MAiD. And it's important that the funeral professionals are comfortable and knowledgeable about MAiD, but also hold this information in confidence. There is some degree of stigma still around the issue of MAiD and how people react, or professionals. There's been study respond when the conversation of MAiD comes up, has a huge impact on families, and this can impact their grief and bereavement journey as well. So it's important that families feel safe talking about MAiD with funeral professionals. As you also mentioned, the funeral transfers also have a potential impact on how people experience MAiD, particularly those who are supporting those who are receiving MAiD. And the smoother the process and the better that is organized, the better experience that is for the family, then that also has a positive impact on their grief and bereavement experience and how they process the general MAiD experience. So funeral professionals have, can have a significant impact on how that experience happens and what the impact is for future. One of the things MAiD House can facilitate, so when people are having the procedure in the community, then a person from MAiD House actually can be in conversation with the funeral home and make sure all the key logistics that need to happen, so that when the funeral home comes to do that transfer, the family is ready for that transfer to happen. So there are some added kind of steps and support that happen when it happens in the community at MAiD House, where when it's happening in an individual home, that might be less clear.